Hi, I'm Angela, and I'm going to talk about the effects of high blood pressure on the human body. So, first of all, high blood pressure is defined as greater than 130/80. And I think it's important to first talk about the effects of high blood pressure on our arteries. So, what I tried to draw here is a blood vessel. And what happens when the pressure of our blood is high for a long time is we see on this inner lining that we get these small tears. And the body, in a response, tries to fix them. And what you see is then a buildup of plaque. Now, plaque is made up of different parts going through that blood vessel. So we can see fatty substances, cholesterol, cellular waste products, calcium, fibrin, all sorts of things that develop this sticky substance that eventually hardens and causes the blood vessel to get really stiff and blocked, or sometimes even it'll lift up and cause a blood clot. So that's the main way it's going to affect the arteries. You'll also sometimes see aneurysms develop. So because of the constant pressure of blood moving through a weakened artery, it can cause part of the artery wall to bulge and even burst open, which is like life-threatening bleeding inside of your body. Next, I want to talk about the effect on the heart. So the coronary arteries are the arteries that supply the heart muscle. And so when these arteries are damaged or weakened, stiffened, you can see it leading to things such as arrhythmias or heart attacks. Also, over time, just from excessive pressure, you can see the heart muscle weaken. And lastly, because the heart has to work so much harder to pump the blood to the rest of the body, you can see a thickening of those left ventricle walls, and that can be something that contributes to sudden cardiac arrest. Moving on to the brain, when the blood vessels that supply the brain are blocked or weakened or affected by the high blood pressure, it can lead to a transient ischemic attack or stroke, which is just when these blood vessels get blocked and the brain isn't getting the blood it needs. It can also lead to dementia from blood flow being limited to the brain, or to a lesser extent, it can cause mild cognitive impairment, and that's just trouble with memory, thinking, language, stuff like that, but it's not as severe as dementia. And lastly, I want to talk about the eyes and the effect of high blood pressure on the eyes. So the blood vessels that are going to the eyes are very tiny and very delicate, and this can cause retinopathy, which is damage to the blood vessels supplying the retina. It can lead to bleeding in the eye, blurred vision, or a loss of vision. We can also see nerve damage to the optic nerve, which can cause loss of vision as well. I think it's important to talk about the effect of high blood pressure on the body, because hopefully it encourages patients to monitor their blood pressure, to go get their physical exams and check on that every so often. But additionally, if there is high blood pressure, hopefully it encourages them to get treatment because of just the widespread effects of high blood pressure on the human body. Thank you.